Hi, I'm Linda, the creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, where you can find out more about this terrible disease. Colitis and Crohn's disease are not arthritic diseases, but they can be associated with arthritis in some way. Both colitis and Crohn's disease are types of inflammatory bowel disease, IBD, that affects the gastrointestinal tract. When you develop ulcerative colitis, or inflammatory bowel disease, it causes chronic inflammation of the colon, large intestine, and rectum. The symptoms are inflammation and ulcers in the inner lining of your colon and rectum, which can lead to complications. There is another bowel disorder called Crohn's disease, which is related to ulcerative colitis, that could have an impact on your life. In this video, I shall explore the best treatment for ulcerative colitis, its causes, symptoms, and diagnosis. Ulcerative colitis causes inflammation and ulcers in the innermost lining, mucosa, of the colon and rectum. The causes of ulcerative colitis are not fully understood, but it could involve a mixture of genetic, environmental, and immunological factors, which could include: Number 1 is that it tends to run in families. If you have close relatives who have this disease, you may be at high risk of developing it. Number 2 is the immune system dysfunction. This means that your immune system sometimes mistakenly identifies harmless substances in the digestive tract. This means that certain foods or beneficial gut bacteria are a threat, leading to an abnormal immune response and causing inflammation and damage to the colon. Number 3 is certain environmental factors can trigger the symptoms, such as certain foods, smoking, and exposure to certain infections. The symptoms could include diarrhea, abdominal pain and cramp, rectal bleeding, or weight loss. You could also feel fatigued, or an urgency and incontinence. You may have other symptoms like joint pain, skin rashes, eye inflammation, and mouth ulcers. Diagnosing ulcerative colitis involves a combination of medical history, physical examination, endoscopy, or colonoscopy. Blood tests can help to assess inflammation levels and check for anemia and other complications. You could also have X-rays, CT scans, or MRI to rule out complications. You will be prescribed medication to control the symptoms, and it is the first line of treatment, which will be for mild to moderate ulcerative colitis. Some foods can worsen your symptoms, so it would help if you modify what you eat. You must avoid the trigger foods. It may be best if you go on a low residue or low fiber diet. With my colitis, I go for free from or gluten-free foods. These are helping me with my symptoms and could help you. Another one is stress, which can worsen your symptoms. The best way to help stress is by doing some yoga, meditation, and deep breathing exercises. Exercise is another one. Regular physical activity helps reduce inflammation and relieve stress. However, you need to consult with your healthcare provider to see which ones are correct for you. Some medications may not give you adequate relief, so surgery may be recommended. The most common surgical procedure for ulcerative colitis is a colectomy, involving the removal of the entire colon and rectum. But surgery is considered when there are complications, such as severe bleeding, perforation, or cancer risk are present. Ulcerative colitis is a chronic condition which requires ongoing care and monitoring. You should have regular checkups with a gastroenterologist so that they can track your disease and adjust the treatment accordingly. Living with ulcerative colitis or Crohn's disease can be challenging. The next list is how you can cope with the pain and dashing to the toilet 24/7. Managing your symptoms when you are having a flare-up. You could experience abdominal pain, diarrhea, rectal bleeding, fatigue, and other symptoms that can disrupt your daily routine. It is advised to identify which foods to avoid as they could cause discomfort, which you should avoid altogether. They could be red meat, fried foods, or sorry, you should avoid cakes. You should also manage your medication. Irritable bowel disorder can require a combination of medications, which can be costly and may have side effects. With my colitis, I take 1 tablet 1/2 to 1 hour before my main meal. On top of this, I also have a tablet half an hour before each meal. Not at all nice, if you want to go out for a meal. You should have regular monitoring, meaning that you should keep all your appointments with your healthcare providers for medication adjustments and monitoring. The next is your emotional and psychological state of mind, as this could become worse as the unpredictability symptoms of the disease may lead to stress and anxiety. Also, when coping with the need for frequent visits to the bathroom and having to go on a strict diet, it can lead to social isolation and impact one's social life. There are some strategies that you can use to cope with this disease that can help you in your everyday life. They include: always follow your medical advisor, healthcare provider, and registered dietitian. It would help if you did some meditation, yoga, and relaxation methods to keep down the stress and anxiety. You need to do regular exercises each day. This can also help improve overall health. Tell your employers about your condition. It can help, and maybe see if you can do flexible work. Colitis mainly starts in the rectum and extends throughout the colon, affecting the inner lining, mucosa, of the intestinal wall. The symptoms of colitis are abdominal pain, frequent diarrhea, urgency to have a bowel movement, and rectal bleeding. These symptoms are mainly in the lower part of the digestive tract. Complications of colitis could include narrowing of the colon and could have a risk of colorectal cancer. On the other hand, Crohn's disease attacks the gastrointestinal tract, which could be from your mouth all the way down to your anus. It can often involve healthy parts of the digestive tract between the inflamed areas. The inflammation can go through all layers of the intestinal wall, which could lead to complications, such as abnormal connections between the intestines and other organs, and abscesses or boils, sores. The exact cause of both colitis and Crohn's disease needs more research, but it is believed to have risk factors of genetics and the environmental, such as diet and exposure to certain infections. The treatment of both diseases often involves a combination of medications to reduce inflammation, help manage your symptoms, also to prevent complications. In severe cases or when complications arise, surgical interventions, such as colectomies or bowel resections, may be necessary. Colitis and Crohn's disease are two distinct inflammatory bowel diseases, each with its unique features. If you or someone you know is experiencing symptoms related to these conditions, it is important to seek medical evaluation and guidance from a healthcare professional. They can give you a proper diagnosis and tell you how to manage the symptoms, with the appropriate care and support. Living with these diseases presents unique challenges, but it is important to remember that with the right strategies and support, you can lead a fulfilling life. Effective management involves a combination of medication, dietary management, stress reduction, and lifestyle adjustments. With the appropriate care and coping mechanisms, it is possible to navigate the challenges of these conditions and lead a meaningful and rewarding life. I am not a medical professional, and this blog is for information only. If you are worried about anything, it is best if you see your doctor. I hope this video has helped. If you have any questions about this video, or any other of my videos, please leave a comment below.